Hello you guys, my name is Miguel Gomez, fellow Xray tech student here, giving you some information to help you through your Xray education. So today we'll be looking over how to deal with geriatric patients. For those who don't know the name, geriatric means patients usually above the age of 65 or have some sort of condition that makes them hearing impaired, hard hearing, hard seeing, something that makes them as older you get, like Alzheimer's, something like that, right? So for the most part, most people you meet at that age, I call them they'll either be very nice and friendly, or they'll be the little old cranky people that don't want to do anything, or they'll be the "are we done yet" people. And then you also meet the ones who just want to talk and talk and talk. And then there are ones that don't talk at all. And then there's the ones that you have to repeat the instructions so many times to them. And then there'll be the ones who are confused and don't know why they're there. Those are some of the most common ones you meet. So for the most part, especially if you're doing like spine exams and you have to get in a hard table, explain to them what you're going to do, how to do your exam, what they can expect, and try to be there, especially if they're more fall risk patients and they look like they need more helping. Make sure to always try to, hold on to them, assist them. There's some patients that like to be independent, so they won't want you to help them at all. So just kind of be there close to them just in case something happens, they slip or fall something, you can be right there and catch them and help them. And then some patients you'll need to help them, assist them, drop them down to the table, help them get up, especially getting up and standing, like or just sitting on the table on top, giving them a minute because sometimes they get dizzy or they get lightheaded, or some people have bad backs or bad knees. You got to watch out for that. And try to talk to them and explain the instructions, because there's some patients you have to explain the instructions or tell them to hold still, or some of them they're hard hearing, so you got to be yelling, and so that makes me always feel bad when I got to yell because I feel like I'm being mean, but sometimes they just can't hear. And you have to be aware, if they're wearing hearing aids, or some patients they'll be some patients you'll hear more of the elderly. I know for myself as a Hispanic person, more of our older generation parents or grandparents, they don't know English. So that's another big thing that, especially here in America, that's we're the second biggest ethnicity. So if you know Spanish, especially with more older elderly patients, they don't know English. So if you're able to speak in Spanish and translate them, it'll make that situation more easier. Because I've seen before, there'll be one, they don't know English, so you're basically telling them in English what to do, and they're just staring at you like they don't know what to do. If you're found in one of those situations, either find someone that knows how to speak Spanish, or just grab them, let's say it's a hand X-ray, grab their hand and assist and try, to work around. Try, as long as you're trying to assist them, and look, they'll be able to work, to hold on. So sometimes it is good to know some bare basic Spanish, because sometimes it does come useful. And then also for your technique, for those, you have to adjust your technique. Sometimes they'll be because of osteoporosis or for some medical conditions they have. You'll have to tweak your techniques. Sometimes lowering them, or if they have prosthesis, you have to make sure to include that. And you have to be aware some patients have surgery, or they'll have AFibs, or they have heart monitors, or they have a bunch of things that will affect your image. That's another thing to keep in mind. And especially for the patients who just love to talk and talk and talk, try to be nice and listen to them, because sometimes you're the only human interaction they have, and you try not to be rude. Sometimes they'll just talk and talk and talk. try to be nice, and as they're talking, be like, okay, well, that's good. Okay, this, talk with them and try to maneuver them to assist to get into the position exams to be able, to get that done. And you'll have different. I know more for ladies. You have like the old lady that never wants to leave her purse. She'll have like a giant purse with everything on, and she'll just be carrying it with her, and she's afraid of something getting stolen, something getting taken care of. So always make sure if you're gonna put their belongings somewhere, kind of keep it within their eye distance to keep it safe there. And depending on certain procedures, like if you're gonna do like a C-spine, some patients do have like special like their teeth, like the ones that can be removed, or they have like little metal. I'm not sure what they're called, but some of them they can be removed to help reduce any type of artifacts in the images. And for the most part, some are walkie-talkies, some of them are more hard-headed and more difficult to get the exam done. But at the end of the day, we too will get up there, and you always have to be nice. I take it as every elderly patient, I treat them like my grandparents and try to be nice, because I too, all of us will get old one day, and we want the best care and someone to be nice and not to treat us mean. So that being, keep in mind, always try to do good patient cares, and always try to keep them warm, give them blankets, because most of the time they will be cold since they're in the hospital's cold. So always try to cover them up, keep them warm. Try to do anything you can, to make it easier, because some of them, they're there all day. Literally, they have a bunch of appointments. They're there at the hospital. So literally anything nice you can do, they will appreciate it. And yeah, I hope that helps.